Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Imagine you're raising a child with a serious illness, and you're constantly thinking, are these treatments really going to work long term? If that feeling resonates, well, you're definitely in the right place.
That's a worry so many families face.
Exactly. Today, we're taking a deep dive into sickle cell disease. It's a condition affecting red blood cells, causing some pretty significant health challenges, especially for kids.
And specifically, we're zeroing in on hydroxyurea.
Right, hydroxyurea. It's a key medicine for managing sickle cells in children, and we want to explore how effective it really is over the long haul.
We got some good material to work with today, a recent article in Blood Advances, and crucially, the original research paper it discusses.
So this isn't just a summary. Our mission today is to pull out the really key insights about hydroxyurea's lasting benefits, maybe its limitations too, and what the experts are actually saying. We want to provide some clarity for anyone affected by or interested in managing childhood sickle cell disease.
And what's interesting right off the bat is the study's goal. We have a decent idea of how hydroxyurea helps in the shorter term. But this research wanted to know, what happens years later? Do those good effects continue? Do they maybe fade or change somehow in the real world outside of those very structured clinical trials?
Okay, so moving beyond the trial setting, how do they actually tackle that question? Looking at the long-term picture.
Well, it wasn't a typical trial where you randomize people. Hydroxyurea is standard care now. So instead, they did what's called a quasi-experimental study.
Quasi-experimental.
Yeah, basically they look back at health records, a lot of them, 2,147 kids under 18 with sickle cell anemia, treated at Children's Healthcare of Atlanta between 2010 and 2021.
Wow, that's a big group.
It is.
Huh.
And they use some pretty clever statistical methods, differences in dynamic event study analyses to compare the kids' health when they were on hydroxyurea versus periods when they weren't, trying to account for other changes over time.
Right, trying to isolate the drug's effect. What were the specific criteria for a child to be included in this look back?
Okay, so they needed to have the more severe forms, hemoglobin SS or hemoglobin S beta 0. They also needed at least 3 clinic visits recorded.
Makes sense.
And importantly, they excluded kids who had had a bone marrow transplant, gene therapy, were on chronic transfusion programs, or took other disease-modifying drugs besides hydroxyurea.
So really focusing just on the hydroxyurea effect as much as possible.
Exactly. And they analyzed the data using patient years, basically looking at how many years of data each child contributed at different ages.
Okay. So what were they actually measuring? What were the key health outcomes they tracked?
The main ones were, first, the number of emergency department visits per year. Second, the number of days spent hospitalized per year. And third, the average hemoglobin concentration.
Hemoglobin, that's the oxygen carrier in the blood, often low in sickle cell, right?
Precisely. They also looked at mean corpuscular volume. That's the average size of red blood cells, and absolute neutrophil count, a type of white blood cell. These last two can sometimes hint at how well someone's sticking to their medication schedule.
Ah, okay. That leads to a key question. How did they figure out if a child was actually using the hydroxyurea in the study, since they were just looking at records?
Yeah, that's a crucial point in real-world studies. They defined use as having an active prescription for hydroxyurea recorded for more than 50% of their clinic visits within a given year.
50%.
They also ran a check using 80% just to see if it made a difference. But, and this is important, they couldn't know for sure if the prescriptions were actually filled or if the child took the medicine every day. It's based on the prescription record.
Understood. So using prescriptions as the best proxy they had, given all that, what did the analysis show? What were the big takeaways?
Some really positive findings emerged. First, kids on hydroxyurea had fewer emergency department visits each year. The average effect was about 0.36 fewer visits per year for those treated.
Not insignificant.
No, definitely not. And that benefit appeared pretty steady over the years they looked at. Second, hydroxyurea use was also tied to fewer hospital days annually.
How much of a reduction there?
The average was about 0.84 fewer hospital days per year. And again, this effect seemed consistent over time, particularly when they focused on the group that started treatment really young, around age 1.
Fewer ER visits, fewer hospital days, those sound like major improvements in quality of life. What about the hemoglobin levels you mentioned?
The hemoglobin story was a little more nuanced. Overall, starting hydroxyurea did boost hemoglobin initially by about 0.56 grams per deciliter on average.
That sounds good.
It is, but that initial boost didn't seem to hold up quite as strongly over the very long term when they looked at the whole group together. However,
There's a however.
yes, and it's an important one. When they zoomed in on the subgroup of kids whose blood tests showed signs suggesting good adherence, specifically that increase in mean corpuscular volume we talked about.
Oh, larger red blood cells.
Right. For those kids, the improvement in hemoglobin was actually much more sustained over time.
So adherence seems really key for that particular benefit. That definitely has implications.
Huge implications. Like Dr. Wilbur Lamb pointed out, one big takeaway is reassurance for families and doctors.
Reassurance how?
Well, hydroxyurea started life as a chemotherapy drug, right? So there have always been these sort of background worries about long-term safety. This study, showing sustained benefits in a real-world setting, really helps ease those fears. It works outside the lab over the long run.
That's a really powerful message. And you mentioned the adherence link for hemoglobin.
Absolutely critical. Dr. Paul George really emphasized this. Seeing the sustained hemoglobin improvement tied to signs of taking the medicine regularly just underscores how vital it is. Consistent daily use matters.
So ongoing conversations, support for families to keep up with the medication schedule are crucial.
Definitely. It reinforces the need for that continued counseling and support.
So putting it all together, this research really bolsters the case for hydroxyurea as a cornerstone of long-term management.
It does. It confirms that this drug, probably the most effective one we have readily available for sickle cell disease right now, delivers significant lasting benefits, fewer crises, fewer hospital stays in the context of everyday life, not just in tightly controlled studies.
And you mentioned earlier the researchers thought their study design could be useful elsewhere.
Yes, that's an interesting side point. They suggested that this kind of real-world data analysis, these quasi-experimental methods, could provide a good framework for evaluating other sickle cell treatments down the line.
Like stem cell transplant or gene therapy.
Exactly. As those become more common, we'll need ways to track their long-term effectiveness in the real world too.
Okay, but like any study, especially one using real-world data, there must have been some limitations, right? Things we need to keep in mind.
Oh, for sure. And the researchers were upfront about them. Working with existing records always has challenges. For instance, relying on those lab markers as a proxy for adherence isn't perfect. You don't know for sure if they took every pill.
Right, it's an educated guess.
Pretty much.
Yeah.
And they didn't have complete data on things like intermittent blood transfusions or maybe specific acute events that could temporarily mess with hemoglobin levels.
Okay. And what about the statistical methods? You mentioned assumptions.
Yes, that difference in differences approach relies on an assumption called parallel trends. Basically, you have to assume that the treated and untreated groups would have followed similar health trajectories if the treatment hadn't happened.
And did they?
Well, for ER visits and hemoglobin, the trends before starting treatment looked pretty similar between the groups, which is good. But they did note a statistically significant increase in hospital days in the year before starting hydroxyurea for the treatment group.
So maybe those kids were already getting sicker, which is why they started the drug.
That's the potential bias, yes. It complicates interpreting the hospital days result just a little bit.
Yeah.
Cause and effect get tangled.
Understood. Were there other limitations tied to the data source itself?
A few things. It's data from a single, albeit large center, Children's Healthcare of Atlanta. So generalizing the findings to all kids with sickle cell everywhere needs a bit of caution. Different places might have different patient populations or care practices.
Makes sense. One center isn't the whole world.
Right. Also, ER visits and hospital days are important, but they don't capture everything about disease severity or quality of life. And they had to exclude kids who were lost to follow up for more than 2 years, which could potentially skew things.
And what about the very long-term data?
Yeah, they acknowledged that the number of kids who had been on hydroxyurea for the longest periods, like 8 years or more, was smaller. Fewer data points means the results for those later years have a bit more uncertainty around them. Wider confidence intervals, statistically speaking.
Okay. And just to recap, the missing data on transfusions and acute events impacting anemia.
Correct. Those are things that could influence hemoglobin that the study couldn't fully account for.
It's crucial to understand those caveats. So bearing those limitations in mind, what was the overall verdict from the experts involved, like Dr. George and Dr. Lamb?
Well, as we touched on, Dr. George really doubled down on the main message. Hydroxyurea remained effective over time. But he also strongly linked the hemoglobin improvements to regular intake, stressing that need for adherence counseling.
In Dr. Lamb.
Dr. Lamb focused on the reassurance factor. Given the drug's history, he felt this real-world data showing long-term benefit and safety outside of strict trials was incredibly valuable and comforting for patients and families.
So, despite the limitations inherent in real-world data, the experts seem to feel this study adds significant weight to the evidence supporting long-term hydroxyurea use.
I think that's fair to say. They see it as reinforcing hydroxyurea's role and, critically, highlighting that making the most of it means taking it consistently. Adherence is key.
So, for listeners, especially those directly impacted by sickle cell disease, what's the core message to take home?
I think the main thing is that this study provides pretty strong evidence that the benefits of hydroxyurea, particularly reducing those disruptive emergency visits and hospital stays, can be long-lasting for children. But realizing the full potential, especially for things like hemoglobin levels, really hinges on taking the medication consistently, day in and day out.
That's clear and valuable. So, final thoughts. What should listeners do with this information?
Definitely, if this affects you or your child, talk to your doctors. Discuss these findings, ask how they apply to your specific situation, share any concerns. That dialogue is essential.
Good advice.
And if you want to learn more generally about sickle cell research, reliable sources like the American Society of Hematology or the National Institutes of Health have a wealth of information.
Excellent resources. You know, this deep dive really gives such a valuable long-term view on managing sickle cell. It really makes you wonder, doesn't it? What other chronic conditions in childhood could benefit from this kind of real-world long-game analysis of the treatments we already use?
That's a great question. Applying these methods more broadly could potentially uncover a lot about how well our standard treatments are really working over time.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.